Hello guys, my name is Dr. Harshvardhan Sinha. I'm a prosthodontist and implantologist based in Lucknow, Uttar Pradesh. Today I'll be talking about the oral anatomy in a briefly so that you get all the aspects which are required to talk to dentists about the oral anatomy. So firstly, what is dental anatomy? What is anatomy? Anatomy is like the description or the morphology of a place, person, or anything. So what is a dental anatomy? Dental anatomy is an anatomy which is only stick to the dental part of the teeth. So dental anatomy is the study of the morphology of teeth, their location, position, and the relationships. It is a subject studied in dentistry to meet the needs of the curriculum of colleges of dentistry. Oral anatomy is a fundamental of dental sciences on which the oral health care provider is based. So a lot of dental students go through the education for dental anatomy in the first year of college. Then this, what is dentition? Teeth, all the teeth collectively are called as dentition. Like the humans have a deciduous dentition which has 20 teeth and a permanent dentition which has 32 teeth, which we'll come to that later. And what is a dental arch? So the dental arch consists of two arches. One is the maxilla and one is the mandibular. So the maxilla is the upper jaw and the mandibular is the lower jaw. And the dental arches are hence divided by the quadrant. So if you divide each jaw, maxilla and mandible, they can be equally divided into two quadrants. And each quadrant consists of one central incisor, one lateral incisor, one canine, two premolars, and three molars. So that is how the arch is divided into the maxilla, mandible, both. So there are a total of four quadrants. First, we will be talking about the maxilla. Maxilla is the jaw or jawbone, specifically the upper jaw. It is also referred to as upper jaw, and the teeth which are in the maxilla are called maxillary teeth. So there are 16 teeth in the maxilla, with the same incisors, two pairs of incisors, two pairs of canines, four pairs of premolars, and six pairs of molars. Then the mandible. Mandible is the jawbone, or specifically the lower jaw. And the teeth housed in the mandible are called the mandibular teeth. Then the jaw, when the person has teeth, the person is that kind of dentition is called the dentulous dentition. When there are all kinds of teeth present. But when one or the some, when the totally all the teeth are missing, it's called completely edentulous. When the person has one teeth missing, that area is edentulous in the region of edentulous with missing central incisors, edentulous with respect to missing lateral incisor, canines, premolars, and molars, hence like that. Then we'll come to the classification of teeth. So as I had mentioned earlier, we have four different kinds of teeth in human beings. So there are central incisors, then lateral incisors, then canines, premolars, and molars. So as you can see, the number of canines and premolars there are two canines. In each jaw, there are two canines. Each jaw, there are four premolars. Each jaw, there are six molars. And each jaw, there are four incisors. Hence, you can come to that conclusion which teeth is missing, and appropriately, you can say that area is edentulous or not. And what are the parts of the teeth? So the tooth is divided into three parts: the crown, neck, and the root. Basically, we are focused on the crown and the root structure. Crown is that structure which you can normally see into the oral cavity. The root is the structure which is embedded into the bone. Root is not usually visible clinically. Then there are tooth layers. So tooth consists of four layers. Enamel is the outermost layer. It is the hardest tissue in the human body. Then below the enamel comes the dentine, which is slightly less denser than enamel, and it is not as strong as enamel. Hence, it is prone to more of the carious dental infection, which we can talk about later. Then comes the pulp. Pulp is the centermost portion of the tooth, which consists of blood vessels, nerves, and connective tissue. And there is one more thing, one more layer, which is called the cementum. Cementum is a layer which only covers the root of the tooth. It is present outside on the dentine, on the root of the tooth. It is embedded into the bone. the tooth layers. Here in this picture, we can see like different teeth have different pulp structure. The pulp structure in molars and premolars and canines and central incisors are totally different. The enamel structure is also different. The tooth morphology in general of all the teeth are different. They have a specific dental anatomy which we should adhere to. Then comes the regional classification. So from incisors to canine, or these teeth are called the anterior teeth, and the canine and the teeth which consist of the premolars and the molars are the posterior teeth. Then there are tooth numbering systems. So we'll be talking about three tooth numbering systems. First is FDI, Palmer, and Universal. So Universal is easily the most commonly used. That's why the name is called Universal. It's followed everywhere. So how do you number these two? So when you are using the Universal system, your right side, third molar will be number 1. Then as you come forward, the tooth number will increase. So second molar will be number 2, first molar will be number 3, second premolar will be 4, first premolar will be 5, canine will be 6, lateral incisor will be 7, and central incisor will be 8. And then again you go from 8, then there is 9 to 16, then you come down, then 17 to 24, and then 25 to 32. That is how you go with your universal system. Then I'll talk about the FDI system. FDI systems you can has divided in your 4 quadrants. So the maxillary right quadrant is called number 1. Maxillary left quadrant is called number 2. Maxillary mandibular left quadrant is called number 3, and mandibular right quadrant is number 4. So when you're talking about the teeth numbering, so when I'm talking, it's like 1, 1. So first quadrant, maxillary right side, first quadrant, first teeth. So it's always a central incisor. And 1, 2 will be maxillary right side, lateral incisor, hence so on. Similarly, 2, 1, 2, 2, 2, 3 to 2, 8, and 3, 1, 3, 3 to 3, 8, and 4, 1, 4, 3 to 4, 8. Then comes lastly the Palmer system. So in Palmer system, whichever side quadrant teeth you are mentioning, you make a square shape, and that side make one arrow horizontally and one arrow vertically, and there you write the 1, 2, 3, 4, 5, 6, 7, 8. That is that side of teeth. So if you are taking this side, then you will make right side, then you will make that diagonal vertical towards this side. When you're going towards the left side, you will make the vertical and the horizontal towards this side. And when you're going down, then like this side. So that's how you divide the Palmer system. The tooth numbering system is very easy. If you can go through and have a look at this chart, everyone can get through the tooth numbering system. It might seem complicated, but it is very easy. You can easily number the tooth. So in India, we usually follow the FDI system. In US and other countries, the universal system is much more followed. Then lastly, there are the tooth surfaces. So this tooth has a distal surface. Distal is the farthest surface. So if you take this midline, if this is the midline, and we take the central incisor. So like the farthest most side is the distal. The middlemost side is the mesial. The front side is the facial. Back side is the lingual or palatal. So that is how, and the topmost, like this surface, is called the incisal surface. So that is how you define the tooth surfaces of each and every teeth. So actually the anterior teeth, we call it as the labial surface because they are present in front of the mouth. And because in the posterior teeth, the facial surface is called the buccal surface also. Because they are facing the buccal mucosa. This is called the buccal mucosa. And then the posterior teeth have an occlusal surface instead of an incisal surface, which we see in the incisors and the canines. And then there is the proximal surface. The proximal surface is related to both the teeth. When the teeth are in contact, the middle, where they are in contact, either the mesial or the distal of any teeth, in the middle, it's called the proximal surface. So mouth has different actions. We eat, breathe, eat, speak, attract, drink, suck, spit, kiss, make music. So the mouth is always in action. So that's why the teeth have a very important role to play. And hence, every teeth has a specific job which they have to do, including the phonetics, to cutting of food, chewing of food, making music. Teeth are very important, and they help to keep the mouth in perform all its actions. Thank you. Good luck.